everyone, it's Maddie. Welcome back to my channel. And if you finally can tell, I've gotten around to doing my dental hygiene school semester 3 video. The third semester for us, I should say, ended in like the beginning of November. Due to COVID-19, we kind of pushed our clinicals a little bit faster. We were going 4 days a week for 11 and a half weeks straight, or 12 weeks. I can't remember the exact amount of weeks, but we were doing that so that we were done well in advance of Thanksgiving and Christmas, and I'm so thankful we did because of the amount of surge of cases that continued to happen as people were traveling during this pandemic here. Now, I'm currently in my 4th or 5th week of my very last final semester of the dental hygiene program, and I can't believe that I'm going to be graduating in May. And I did not, I expected time to fly, but I really didn't think like it was going to fly this fast. And it's amazing how much you can see growth from semester to semester as you begin your clinicals and as you treat patients and as you learn and grow with different things. So with that being said, I'm going to go ahead and talk about each of my classes like I do in every video. I'll show you the books, kind of what you learn, that kind of thing. And again, my schooling may be a little bit different than yours if you were in a different state or in a different area or in a different college. Like I said, I'm not quite unveiling where I'm at college yet. Unless you personally know me, you know where I go. But again, it's just to protect myself, just because I am putting myself out in the public here. I am putting myself out on public display for people to interact with. So anyways, with that being said, let's jump right into the classes. Well, I guess I will start with probably the most laid-back class of 3rd semester, and that was dental materials. So if I were you, I highly suggest, if you didn't notice in my 1st semester, my 2nd semester, that everything is kept in a binder so that you're able to keep things neat and organized, and it makes it much more helpful when it comes to studying for your national board exam. So I kept each class in a binder, and this is the book that we used, Dental Materials, Clinical Applications for the Dental Hygienist. Now, we tapped into this book a little bit, like we had to read some of the chapters, but we really didn't touch into it too much. It was mainly more what we were learning in the lab portion. Now, my college basically says all lecture components now must be online or via a WebEx or a online-based type learning setting to avoid the spread and slow the spread of COVID-19. And then we kept the lab component once a week for 2 hours where you're learning the hands-on components of dental materials. So I broke down each week by week. I took some notes in different chapters. Our teacher was super nice to give us lecture guides and reading guides so that we came prepared to lab class very well. We did things like learning how to disinfect and handle partials and full dentures, because we had to do an evaluation with that on a patient with a partial or a full denture in clinic, and we have to do it again in our 4th semester. But it's not really like they're going to watch us anymore. We just have to do it, and then they sign off on it, if that makes sense. It's part of our experiences. In order for me to be licensed as a dental hygienist, the state of Wisconsin says I must have X amount of experiences treating X amount of patients, X amount of different age groups, X amount of different levels of periodontal disease, X amount of different levels of tartar buildup on teeth. You get the point. So you kind of have to do a variety of different things. And for a lot of it, you have to find your own patients. And at least in my college, you have to find your own patients. So my own grandma was my partial denture patient, and she had her hip replaced this November, but I saw her before she had her hip replaced. But we weren't going to actually clean the few real teeth that were in her mouth because they didn't want to induce bacteria prior to her surgery. But now that her surgery is over, she will have to take an antibiotic for the rest of her life. And she's going to come see me in spring one more time so that I can actually clean her real teeth, meaning that I can use as an age requirement. We have older adult individuals, so many of those we must see, so that will count. The amount of, whatever amount of tartar is on her teeth will put her into a classification for tartar, and that will count as a requirement for me, as well as she probably will need a fluoride treatment, possible desensitization on the bottom, just because of some sensitivity problems. And then again, I get to clean her full denture on her top and her partial on her bottom, and I can get that knocked off my list. So that's kind of how that kind of goes with different things. So certain classes will teach you different things, and then you try to apply it into your clinical setting. That was like the first week that we did anything in dental materials. Then it was learning more of the things, like how amalgam is made in an amalgamator, how do you put together resins and, different, what inlay versus onlay. We did like impressions at the end on each other at the end of the semester, and we got to be able to make bleaching trays. I'll put a picture of mine in here, and our teacher was so kind enough to write each and every single one of us that took the class a little note, and it was super encouraging and super sweet. And it's just rewarding when, like, you know, what you're doing is gonna like apply to what you're actually gonna be doing. And like I said, dental materials was more of a chill class, only because yes, what we're learning we can maybe able to do and help in the office, like a dental hygienist, like I can take impressions, but that's mainly the job of the dental assistant. But it's still a good skill for me to have, because in the event that I have a opening in my schedule working in private practice or in an office, and they need somebody to step in and fill in and take impressions, I may be somebody who needs a mouth guard made, a bleaching tray made, maybe for orthodontics, maybe there's somebody coming in for pre and post treatment impressions to see how the treatment worked, and I'd have to be the one to take those impressions. So it was really good that we got to learn on each other. We took them on typodonts as well. We made different study casts and molds. We actually were able to trim a study cast, and I will show you mine in a second. And it's kind of funny because the first one I made, like the top part turned out really well, and then the bottom part, the under part, was the much better portion. So like on the second round, so I kind of like combined the two to be graded, and yeah, it's kind of funny. But it was really, like I said, more laid back. It was very hands-on, very entertaining, and like I said, it was just learning all the different dental materials, to what makes up fillings and restorations, to what makes up different bases and liners that might be used for people who are getting root canal therapy or crowns. It's more of the restorative side of like what I need to know as a dental hygienist. And again, this is something more that assistants and dentists really get to know, because they're working hands-on more with the restorative aspect of dentistry. In hygiene, you're more working in the preventative and oral care aspect of dentistry, where your job really is to prevent disease and progression of disease like periodontal disease and cavities. My job, obviously, is to remove plaque and tartar on people's teeth, but also what's more important is educating my patients on how to best take care of their oral health. And not every patient's going to need the same needs. So that is the challenge that I love. I love seeing the differences between each individual's oral health condition and making a plan that really is going to work for them, and to see results change pretty rapidly is pretty cool. And that's something I really got to experience a lot in my clinicals this semester, and I'll talk about that after. But I will kind of show you what some of the hands-on stuff we got to make looked like. I'll first show you my bleaching tray. So this is the bleach that we were given, but these fit perfectly to my mouth, so that if I wanted to whiten my teeth a little bit more, I could. They're clean, so I'll put them in. So in order to make this, like you said, you have to take impressions, alginate impressions on each other, which is kind of that gooey stuff that they put on a tray, and it goes up on your palate, and then the other one goes like on your bottom teeth, and it takes an exact impression of like how your teeth are actually biting, to like the shape of your teeth, the shape of your gums, so because everybody's mouth is just a little bit different. So once those impressions are taken, they're disinfected, and then you pour up the plaster inside, and then from the plaster you trim the plaster, like the little cast of it, and then you put it with our vacuum sealed appliance. That was like one of the last things we learned, and it's a very specific type of like rubbery plastic that's used. There's thicker stuff that's used for like mouth guards, and like retainers are going to be flexible but more rigid than this. As you can tell, this is a little bit more of a flexible rubbery plastic. This is what's typically used for bleaching trays, which is what these are. These aren't retainers. My retainers are a little bit different. They're a little bit harder, and I'm sure you've seen them in videos when I pop them out in the morning for like, you know, like if I'm doing a day in the life or something. I still faithfully wear my retainers after having braces, and you know, I want to keep my teeth straight, but each material is a little bit different. So what happens is you put it in a vacuum sealed appliance. There's a little thing that heats it up, and basically it slaps the plastic on around the mold, the plaster part of your teeth, and it leaves the plastic stuck onto the cast of your teeth that was taken from the impression. So then you're able to pull it off, and then it's trimmed to fit your mouth. So again, it's a more of a hands-on based class, but like I said, it was super duper fun to really get to practice on each other. And we all got bleaching trays at the end of it, which was super cool. And then I kept one of these. I can't remember what unit this was, but I think it was like learning different. I think this is stuff they use more if they're doing like crowns and stuff, but if I remember what it is, I'll let you know. I think this is like the heavy body and the light body weight materials. At first it kind of smelled like a minty rubber, and it is really firm, but I kept it just because of how beautiful it turned out for my eval. But it's kind of a purpley blue color. But that's another thing that we ended up making. And then this was, we just had to pour these up. They were already pre-made, And then we had to learn to pour and mix, you know, the different types of stone. This one's a green stone, so I was able to keep that. This person has all 32 teeth, all the wisdom teeth there, 1 through 32. You can see the third molar's way in the back. So like obviously this is your top, and this is your bottom, and then they just kind of sit together and bite together normally. And then these are the ones that we had to like take impressions and then pour, and then we had to make a study model out of a gypsum stone. Now my bottom turned out much better than my top. My top ended up having to have a bunch of stuff like added to it, but the way you carve this on the actual like stone like machine, like to like literally trim this study model, you literally have to follow a certain pattern. So like this has to be at a certain angle to this, this comes to a point, this is flat on the back. It has to be a certain height when it's articulated together with the bottom. No, I think it's like 2 to 4 inches. Don't quote me on it. And then the bottom is much more rounded, as you can tell. There's not really a lot going on. And like I said, my bottom teeth were better, but like for whatever reason, there was this huge lump in the middle, and I had to try to like shave it down on the thing, but it didn't work out very good. And your goal when you do these study models are really for like certain types of people in the dentistry world that work with people with braces, to people who need different types of restorative work. They want to see exactly what their mouth is like, how they're biting, etc., so they can make the appropriate treatment plan. But things like having a little chip in this tooth is not ideal. You want to have the teeth completely solid and, you know, not have any holes or air bubbles in them. So that means like when you were tapping the stone when it was trying to set, there may have been an air bubble in there, and you have to try to vibrate that out. Like I said, there's a whole bunch of like different things. And then this is a wax bite. So you can tell like where the teeth have been biting in the entire thing. So this gets stuck in the middle. On a real patient, you would obviously have them bite down on this so that this shows exactly what their chewing surfaces is like. And then it shows exactly where the teeth are articulating both back and front, and if there's any malalignment and stuff like that. So these are the different things we got to make. And like I said, I really enjoyed dental material. Super fun class, super laid back. And it was definitely like the bright sunshine to the week, undoubtedly, just because everything else was super stressful. And just, you know, like this class is applicable to me. But on my national board exams, there's really not that much that a dental hygienist gets tested on as far as dental materials. So we really only cover the stuff we're going to get tested on. And a lot of this is just more hands-on experience for me to have in the event that I have to take on more of an assistant role with doing impressions or, you know, helping cut, you know, different diagnostic casts and stuff like that. Like, that's more of the side of a dental tech, assistant, or a dentist. This is not really the hygiene side of things, but it's kind of a requirement that you like get your hands on in different things and understand the process of how different restorations are made and the processes of making study models and all that different things. So like I said, I really enjoyed this class, and it was really a lot of fun. So the second class I took a total of 4 classes this semester, and this one should have been more hands-on, but it wasn't, and it was community and dental health. So this was all WebEx-based course, and I think we kind of jammed it all pretty fast together. I can't remember exactly how things went, but it was pretty much learning how dentistry impacts the community and how community impacts dentistry. So we went through things like understanding how biostatistics works, understanding mean, median, and mode, going through different case studies, and learning how, like, you know, how to apply yourself as a dental professional in the community setting. Now, this had a more hands-on component before COVID. Like, I remember when I was in my first year and they were in their 3rd level of clinic, the girls that had graduated in 2020, they got to go out in the schools and work in the community and put fluoride varnishes on kids' teeth, do how advanced it got, but they got to go in a variety of different public community settings and really get to apply dentistry out into like community-based things. So we didn't really get to have that opportunity because of COVID. They basically shut down all those community-based programs. So we were really just stuck learning all this stuff online. And it made it kind of challenging, only again because I'm such a hands-on person. I would, you know, not that I suck at lecture and that I absolutely despise lecture, but I am so much more like, I would rather be in clinic cleaning somebody's teeth than learning how to clean somebody's teeth in a book. Like, that's how I am, and I think a lot of my classmates can say the same. I don't know if all of them can say that, but I know a lot of us could say the same way. When you get into clinic and actually start doing the hands-on stuff, it is so much more entertaining, it's so much more understanding, and it really makes the applicable connection to what you're going to be doing in the real world. So for me, like, learning this stuff was just like, you know, like, you have to know it, but you, at the same time, like, it doesn't, you know, like, the lecture stuff isn't really gonna, like, carry me into, like, a job. Now, it's good to, like I said, it's good to have that knowledge, and I don't hate learning. I love learning. But when you don't have that hands-on component, sometimes it's really hard, for me especially, to make that application of, like, how am I doing this in the real world, or how does this apply to me? You know what I'm saying? You gotta learn about how, like, different studies are conducted, and how, you know, different, experiments are conducted, as far as, like, knowing, like, how to identify this type of disease in a certain population to this type of a disease in a certain population. And then we had to do several different projects. So there's like 4 different projects that we had to do. So I will go ahead and get those in a little bit. But the first one that we had to do, that I can think of off the top of my head, is we had to pick a country that we had to go through that was kind of more third world, and kind of what dental program that we would set up there as far as like community dental health. And I kind of wrote about how I would go to Tanzania and like really target the young children there and really focus on fluoride varnishes and sealants. And then for the adults, I really focused on just doing screenings for periodontal disease, and then like kind of giving them the application of like how that would work. And then we had to like plan out the cost of the trip, what supplies you would need, how much of a team you would be, how to pack for yourself. It was kind of more like literally like how would you go on an international mission as a dental hygienist or working as a dental professional in a dental group. There are dental mission trips that do things, and I don't know how COVID is impacting them, but I am for sure that COVID-19 has impacted those in some way, shape, or form. I don't know, like I said, the extent or severity, but it was just really opening our eyes to see like, hey, this international could be a totally thing for me, and I honestly would like to do it sometime. Do I want to do it like now? Probably not. But I feel like at some point I would love to try doing at least 1 or 2 mission trips. And I know some of my teachers have done it. And I know a lot of other hygienists that I've talked to have done these types of things, traveled, and really just got to help people in poorer communities or poorer countries really just, you know, get access to the dental care that they need. And it's so vital and important that community dental health stays an important role in our aspect as a dental hygienist, and we keep that in the back of our head that not everybody you're seeing is going to be continuously going to an office all the time or has a dental home. There are a lot of patients that don't have access to dental care, don't have dental insurance, and you really have to open your eyes to see that and understand that. So that's kind of what that paper was about. And then the other 3 projects we did like a varnish portfolio for like if you were going to give a kind of like information to like a young child or a parent whose kid went through like a varnish program at their school, kind of like how to help teach your kids how to brush their teeth and prevent cavities at home. And, you know, with kids, you really got to not like baby talk to them, but you really got to make them understand that like, hey, brushing and flossing, like I like to say to my little kids that I've seen in clinic, like we keep the sugar bugs off your teeth, right? Those sugar bugs like to eat your teeth, and then we have little holes in your teeth, and we call those cavities, and then you'd have to get those taken care of by a dentist. So it's like, not like you're trying to scare the kid, but you need to give them the connection that, hey, brushing your teeth is important to keep your teeth nice and healthy and pretty. You know, like, you're not like you're trying to tell the kid like, oh my gosh, you're going to get tons of cavities, X, Y, and Z, you need to be brushing and flossing twice a day. No. And we don't even do that with like adult patients. Like, you really need to like break it down for them to make them understand that like why things happen the way they do, and like what you can do to help prevent that. That is the role as a hygienist, is to really work on the preventative roles of different things. It's not the restorative side of dentistry, it's the preventative side of dentistry. So that was like our Head Start like portfolio, different things. And Head Start is like more of the young kids based thing. Where it's like young kids up to like age kindergarten. You know, Head Start's a program that goes into daycares, goes into different schools, and basically teaches kids how to brush, floss their teeth, maybe provides fluoride to them, and maybe sealants. And then we ended up doing a brochure kind of with that, so it was kind of like a project, 2-part project that was turned in all at once. And then our paper that we wrote about where we would travel. So those are 3 of the different projects, and again, I'm going to show you them in a minute. And then our final project was really focusing on a very specific topic of community dental health, and like putting together a program for a very specific area. And I believe I put mine together on oncology. We were like given different groups. I think some people were given like super elementary school kids, older populations. Oncology, it was like the one I was given. So we had to write like a whole entire program together about how I would, you know, work with dental care and dental education to people who are receiving cancer treatments. And then I believe there was another one on special needs patients, and then another one on young teen mothers and, you know, pregnancy and related to health with that. So everybody got placed into some different categories. We didn't get to choose. We got chosen our topic for us, and then we had to kind of provide things together. I actually just happened to find my Tanzania trip thing here, so I put a cover page, but then I ended up writing, I want to say it was like 6 pages. And it was kind of nice because it was more of like more of an opinion-based paper. I didn't have to be as formal. So I'm counting the pages, and I'm at 4 pages right now, and I'm not even through it. 5. It's actually like 5.5 pages, and then I have obviously a works cited page here. So 5.5 page paper on Tanzania and a trip to Tanzania. So, like, part of it was like, would you like to do this at some point? And I'll read you the paragraph that I wrote in here if you want a little snippet of this paper. I said, personally, I think at some point I would like to travel internationally and help populations in need of dental care. Not only would I be able to provide the many needed dental preventative services to individuals who are in most need, but I would also be able to immerse myself in a different culture and a way of life that I would never, ever get to experience staying in the United States. I have always wanted to experience the diversity and variety the world has had to offer since I was 4 or 5. The current situation with COVID-19 saddens me, as I know a lot of people across the world are not getting access to care from mission teams due to travel restrictions. And unfortunately, many living in third world countries often rely on mission trips to receive medical and or preventative dental care. With the pandemic, they are not able to have access to this vital and huge part of their care. One of the biggest challenges for me, you know me, type 1 diabetes. So, like, I have to be more able to be willing to plan and kind of put some background plans into place because I need to have, like, medical supplies to take care of me, right? So for me, there's a lot more planning and traveling than the average individual. It is not possible or out of reach, but it is definitely another factor that I myself need to keep in mind when traveling, especially internationally. Before traveling overseas and going on a mission trip, I would like to definitely work in my own community first to give back to the place I've called home for my entire life. So, like, I would like to work at, like, more of, like, a community-based thing here in this area first, and then maybe go internationally. And then I kind of talked about a very specific thing, and I'm not going to say what it is because, like, that would kind of give away where I live. I said I thought it would be a really good opportunity to work in a community clinic, such as having the opportunity to volunteer at said place, or going into schools or other facilities to help place sealants and fluoride varnishes for children who can't afford preventative dental care. And I said I love helping people in so many different ways that I'd love the opportunity to work within my community or internationally is something that I would enjoy. So that's kind of like a part of this paper, but I just thought I'd read that to you. So, like, this is like one of the projects that we did, and like I said, it was like 5 pages long. And I'm gonna go ahead and I think the other projects are in a different binder, so I'm gonna go grab those and I will show you the other 3 projects that we did for this. First one I'll show you is the Head Start varnish portfolio project, and then the brochure that we had to make. So this is like the 2-in-1 project. Because we did a total, like I said, of 4 projects. We had the paper, the portfolio, the brochure, and then another like educational type portfolio. So there was 4 different things we had to end up doing. So this is my Head Start portfolio. I put a little tooth on here, and then this is just a binder. We had to put them all in binders and turn them in. So you have your table of contents. We had to write like what Head Start is, exactly what it is, who founded it. We had to talk about what a fluoride varnish program is, and what types of things you would do there, the roles of the program. So this is more breaking down of what community dental health is like. So in order for us to have like a Head Start program and do like these community-based dental things, you need to have administration. You need to have somebody who's going to be teaching. You need to have the parents involved of the young kids, right? And you need to have the kids involved themselves. Then we had to put a list of different supplies. So if we did more hands-on activities with the kids, we'd have to have like different supplies. And then like for health programs, like when we end up doing the actual fluoride treatments on kids, like you need to have like portable dental chairs, you need to have PPE, you need to have masks, you need to have, you know, a mouth mirror, you might need to have a dental explorer, you might need to have fluoride varnish available, you need to have different barriers to keep the chairs clean and stuff like that. So it was more of the clinical side and then the educational side. So we had to write about like, put a list of supplies of what you would need, and then the scoring guide is somewhere in here. And then to implement it. So a huge part of this class was learning how to implement something. So there's like, for dental hygiene, we go by ADPIDE, which means that we assess what's going on in our patients. on an individual aspect. We have to make a diagnosis, a dental hygiene diagnosis. Now, I can't tell a patient that they have a cavity. That's technically the dentist's job, but I can make a diagnosis of what maybe a patient would need as far as like preventative care. Then we have to make a plan for our patients, or a plan for the program. Then we have to implement the program. And then the big thing is evaluation. So that ADPIDE different acronym, and I'll put it up here and kind of explain it. When we assess, when we give a diagnosis, when we plan, when we implement, and when we evaluate. This can be done on an individual level, like on a patient I see in clinic, and that's what I do very often, or in a big public setting where you're taking a general population and you're trying to make their oral health better in a round kind of overall way versus an individual patient. You're going to customize it to more like, okay, what kind of toothpaste would I recommend? What am I seeing in their mouth as far as what I see on the x-rays? What do I see when I do their gum tissue assessment? Different things like that. So you take your assessment data of the patients, you make your diagnosis, you plan what you're going to do, whether it be with your patient or with the whole group of people. So in the case of like a big group, in the aspect of this project, it would be like really gathering people in groups and really giving them like a fun educational way to kind of understand, about maybe how cavities, what are cavities and how to prevent them. So like for kids, it might be interactive videos, it might be hands-on kind of like little diagrams or little like, not like a model like this, but some sort of tooth model to show them how to brush their teeth and kind of how to get around to each tooth. Kids need a lot of visual things. My adult patients do too, but those kids really need that hands-on and that visual implementation if you really are looking at educating kids. Implementing is just when you're actually going to do it, and then evaluation is huge. In a clinical aspect, I need to evaluate whether the treatment plan that I came up for my patient worked. In some aspects, it's not maybe your treatment plan, but it may be the abilities or the motivation of the patient that affected their things. Some patients are much more motivated to change and make their oral health better than others. You really need to analyze that, but then you also, first of all, need to look at yourself. Maybe it's something I recommended isn't working for the patient. Maybe they're allergic to this type of something. Maybe it's not helping, their gum tissue. Maybe, there's different things that you have to look at first before you say, okay, my patient's just stubborn and doesn't want to do this. And if it's the case of the patient not complying or maybe not understanding something, go back to square one. Start again with, that assessment and go, okay, let's reassess and let's see what I can do to walk that patient through baby steps to improve their oral health. When I'm with my patients in clinic, I don't tell them brush twice a day, floss twice a day, end of story. No, you know what? Maybe my patients are only brushing their teeth once a day. Okay, well, that's a start. That's great. I'm very happy they're brushing their teeth at least once a day. Now, maybe I can try to encourage them, pick 3 days out of the week that you want to brush your teeth twice a day. I don't care what 3 days you do, try it. If they are able to successfully do that, then I would say, okay, now I want you to be doing it all 7 days of the week, brushing your teeth twice a day. And if I can get them to brush twice a day, now let's go ahead and see, what are you doing for flossing? And maybe my patient tells me, you know what, I really only floss if I have something stuck in between my teeth. Okay, well, at least I know that they understand that floss goes in between the teeth. So first of all, I'm going to show them the proper technique to floss, but I'm not going to say you need to floss 7 days a week. I'm going to say pick a day or two out of the week that you want to floss. And if they can continuously do that, we can build them up to the point where they're in a habit and a routine of brushing and flossing regularly. And then maybe really get into understanding of like looking at mouthwash, then looking at like different types of toothpaste. You really got to start from the basics and work your way up. And that's what the evaluation is really about on an individual level. And then on a group level, it's saying, okay, how many different kids did we impact in a positive way? Are there any other things that we have remaining here? What could we do better for our program? And as a hygienist, I look and say, as an individual level, what can I do better for my individual patient? So it's really making the connection between group hygiene and group preventative oral health services to individual oral health preventative services, if that makes sense. So then again, we had to make the brochure, and I'm going to show you that. This is the other piece of the project. So this is the Head Start portfolio brochure that I had to come up with. So this is all about dental cavities. This is really a guide for parents, but it's also a guide kind of for kids because it's kind of got everything in a basic way. So I have different pictures in here, and I talk about what exactly cavities are. What foods happen to cause cavities, what the dental decay process looks like. And actually the way I did it is I put a little picture from Google to kind of show like, hey, if you think about bacteria or them little nasty germs in your mouth, a little kid can understand what a germ looks like, right? Think about all those sweet, sugary, sticky foods you eat. Okay, when you eat something super sweet, sugary, and sticky and you have those ugly bacteria that sit in your mouth, they like to eat the food that you like to eat. When they like to eat your sweet sugary foods, they make something we call acid, and acid is not good for your mouth. So if you think about it, you have this acid in your mouth, and you have your teeth. Now imagine that acid sitting on your teeth and sitting on your teeth. If that sits on your teeth and is not taken off, you're going to get cavities because that acid basically eats away at your teeth. Kind of like you can imagine that water eats away at your sandcastle. I like to use that for my kids. You imagine water rushing up to the shore of a beach and washing away your sandcastle. That's what acid is doing to your teeth. It is wearing it down and wearing it down to the point where you can get a little hole in your tooth, and then we need to fill it. And then you have to see the dentist to go and fill it. Like I said, you don't scare the kids, but you got to make it easier for them to understand. And even for adults, this makes sense. But like, you use it in versus adult versus kids terms because not a lot of people are going to understand the scientific side of what causes a cavity. I mean, I need to, but then it's in turn putting it in lay terms for my patient, right? So then I talk about like what can prevent cavities. Brushing and flossing, number 1. Number 2, do fluoride. Number 3, make sure you're going into the dentist regularly. Find a dental home. Supplemental fluoride. There are certain foods that do have fluoride in them. For young kids, we really like to look at putting sealants on their teeth. In your back teeth, if you ever look, and maybe you do or do not have sealants, depending, I have them. But if you look on the back surfaces of your molar teeth, way in the back, those real big teeth, if you look, there might be some little grooves and little rivers running through them. They're kind of, grooves and cracks. We call those pits and fissures. Those are really good areas for bacteria to get trapped because a toothbrush really can't get, those bristles can't really get in between those teeth. So by preventing like a little plastic coating over those teeth, we call those sealants, it makes that tooth surface a little bit easier for you to clean at home, and then you're less likely to get cavities on the chewing surfaces of your teeth. And then I also talked about in this brochure, like what other factors cause cavities. So obviously, poor or not brushing or flossing your teeth could cause cavities. Not always. What you're eating is a huge part of what can cause cavities. And then certain medical conditions. Diabetes is a huge role for cavities. I have a higher cavity risk just because I'm a diabetic. Number 1, if I don't take care of my blood sugars, I don't have this problem right now. I could have chronic dry mouth. Drying out your mouth, your saliva can't naturally cleanse your mouth out, leading to a higher risk of having cavities on not only the teeth that you can see in your mouth, but eventually on the root surface. Certain genetic factors can play a role for cavities. Some people that have like a malogenesis imperfecta or dentinogenesis imperfecta, where they have weakened enamel or weakened dentin just from genetic factors. That's something that they can't control, but we have to kind of put some other preventative measures in for them. And then on the back is information on Wisconsin's Head Start program. So this is something like I made, and then if you think about it, clinically speaking, I kept that on my computer. I could literally hand this out in private practice if I wanted to. I mean, I don't know if I would, but it's the idea of like connecting community to individual dental health needs. And then we had to put like a resource thing together and a works cited. So that was that portfolio. And then the other one is the one I like have pride and joy on. Not like I didn't enjoy all these projects, but I really enjoyed this one the most because I learned so much about like cancer and oral health and how much impact that it makes a difference on people receiving cancer. It's all on oncology, and again, I put it in a binder. And I kind of like put everything together. I have a table of contents as usual. So you know that ADPIDE acronym that I told you with, right? So we literally had to do ADPIDE. So we literally had to do this and make it. So I had to make an assessment. Obviously, the target population in this case is people with cancer. So I had to talk about how would I assess them. What types of cancer, options for cancer treatment, and oral health needs that cancer treatment patients might need. That's the overall assessment I had to make. Now, not all cancer patients are going to need this type of thing, but if you're providing to a large group of people, say in an oncology center, and you're doing some sort of dental program there, you need to have this kind of stuff set up, right? So then I had to make a diagnosis. So then I'm going to make my assessment. I've assessed my patient. I'm going to make a diagnosis. So, a really big thing for a lot of cancer patients is dry mouth again. So maybe I would say, okay, prioritizing some patient needs, maybe we could talk a little bit about dry mouth products, Biotine, chewing gums, xylitol, things that can really help stimulate that saliva so that they're at a much lower risk for cavities. Then we had to make a planning. To make a plan, you have to have objectives and activities. So, I had things like maybe asking a group of people some questions related to what they maybe know already about oral health and cancer. And then maybe I also implemented, maybe we could do a plaque score on these patients. We put a little dye on their teeth, and we're going to see, exactly where those hidden plaque is sitting, and then we can kind of do some home hygiene with them to really make sure they're getting that off. It's super important if you have cancer that you're really brushing and flossing your teeth a lot, because again, you're at a very high risk opposed to other individuals without cancer for getting different types of diseases, including cavities and periodontal disease. And then activity wise, I was thinking more of like adult type oncology patients, so I would do more like actual brochures and handouts. If it was more of kids with oncology, I would probably do more videos and interactive online hands-on type things with them. Not saying you can't do hands-on things with adults, but I was thinking more in this circumstance, adult oncology patients. And then I would talk about like the materials I would need. I also thought maybe doing like some sample products to send them home with some biotin or some different toothpaste that'd be really beneficial for them. And then we had to talk about team members, like how would you set up a team in an organization to conduct this program? And then implementation. So like, how do you implement this program? And then I did an evaluation. Then I really kind of talked about like, okay, so this is a really good program that I came up with, but I would really like to focus on kids in another way too, because not all people are adults with cancer. There are children with cancer, and as sad as it is, you need to look at that, right? So that's kind of what I really wrote about in my evaluation. And then I came together of like barriers and solutions. So this is something you got to look at for people. And barriers and solutions is true for anybody, but it's in dentistry. Some people have financial roadblocks. Some people, if they are getting cancer treatments and they are weaker, maybe they're not driving as much. Maybe you need to have somebody help transport them to this program so that they can have access to this care. For some people, they speak a different language, or maybe they're deaf, maybe they're blind, maybe there's some, abilities for you to, some ability problems for you to communicate with these patients. So you need to have those types of interpreters to kind of help make sure that you're getting the message across to all people, even if they have a different language, or they are deaf, or they are blind. And then I kind of did a little thing here. This is something I'd hand out to my patients. This is about cancer and oral health, and it's just saying like avoid, candies. Any type of alcohol and tobacco is only going to, aggravate your gums, so don't do that. Particularly with cancer patients, you want to tell them to avoid anything, types of foods that are hot and spicy, things that could agitate their mouth. And then like I also thought about caregivers. A lot of adults maybe have a caregiver, if they have cancer, they may have a caregiver that's helping to take care of them. So you want to give some information to the caregiver as well. And then I talked about basic oral complications that can happen when you have cancer. So obviously dry mouth, just from radiation and chemotherapy. You could also have an increased risk of bleeding gums. You may have some swollen gums and bleeding gums again from those treatments as well. And then you also, because you're taking all these medications that could cause dry mouth, you have an increased risk of having yeast infections in your mouth. So stuff like that you got to make this aware of the patient. And then I showed some different examples that if I were to give this to an actual patient with cancer, I would give them to this. And these are examples of products I would recommend for a cancer patient. So things like biotin for dry mouth. Xylomelts are also another dry mouth product with xylitol. I would also maybe recommend that they go on a prescription-based toothpaste like Prevident 5000 because they're at a higher risk of cavities. So we want to give them that extra boost of fluoride in between their dental visits so that they can prevent having cavities in the future. And then I also talked about mouth rinse. I really emphasize no alcohol in the mouth rinse. Something like a Crest Pro Health Purple or something like a Listerine Pink or Purple or Total Care with zero alcohol is going to be much nicer on their mouth. It's not going to burn. It's not going to hurt. And then I also talked about, like, for people with really high cavity risk, we can do a chlorhexidine rinse, which is like to kill a lot of different bacteria in their mouth. A little harsher of a treatment plan and an aggressive treatment plan, but that's an option for them as well. And then we had to have resources. So, like I said, I really liked doing this project, and I thought it was interesting because I was learning just as much about oncology and oral health as maybe somebody else was, you know what I'm saying? So, I'm kind of glad I got given this topic. So now I have a really good understanding of if I have a cancer patient in my chair. I have not had the privilege yet of having a cancer patient in my chair, like somebody currently taking cancer treatments. But I'm going to run across it at some point in private practice. And, this might be some really good information for me to reference from my schooling. So that is community dental health. And obviously, it's a lot of different things. But like I said, I really, really, especially towards the end, we did a lot of projects, which they were a lot of work. But to me, it was better than like not doing anything as far as like thinking outside the box and exposing myself to different groups of people that I might run into. So yeah, that was community dental health. So I'm hopeful that the students now that are in their second semester, they're already treating their patients, which is kind of cool. that they get the opportunity to go do some of the hands-on stuff that we couldn't do. And I really hope that is the case. And I hope I get the opportunity to do some more of the community-based dental things when I'm, you know, a hygienist, and I maybe get some volunteer opportunities or whatever the case may be. I would love to do this kind of stuff because I think it's really fascinating. So I have 2 more other classes to go through, and then that completes semester 3 of dental hygiene school. So if you can tell, I'm taking like all my lecture classes and doing those first, and then I'll spend the last time talking about clinic level 3 and kind of, you know, the amount of stuff you had to do. So I loved dental pharmacology. Now, when I kind of talk to some other people who have taken it in the past, or like talk about like this class in general, it's either this class, you absolutely love this class, or you hate this class. Because it's kind of like oral pathology. You either love really getting into it, or you absolutely despise pharmacology or pathology. You despise any of them. Mainly because a lot of pathology and pharmacology, which I took this semester, I took pathology in my second semester, a lot of it is memorization. And a lot of it is, you know, memorizing different things, but then you have to be able to readily apply it to your clinical setting. So dental pharmacology is really understanding how medications affect the mouth, and then also learning about all the different types of medications a patient can take. Not every patient you're seeing is going to take the same medications. You also have to learn about different medical conditions and what medications they take, and there are some contraindications with dental treatment. You know, maybe it's with local anesthetic. You know, maybe it's with, you know, getting nitrous oxide. Maybe it's with doing different things in, you know, like using the ultrasonic. There's different things that you got to watch for. So we kind of literally took this class, learning all the different drugs, you know, from, you know, we had to learn like exactly like how drugs work in the body, how they're metabolized, which is called pharmacokinetics. We also had to learn about like how drugs impact the nervous system, because, you know, drugs really do work on your nervous system a lot. And then we got to go into different groups. So like local anesthesia, we talked a little bit about that. And I'm actually almost done with my local anesthesia course for my 4th semester. So this was a good preview for that. Nitrous oxide, that's another thing we're doing right now in my dental pain management class. We had to learn a little bit about that. It was a little sneak peek in our pharmacology class. Things like anti-infective agents would be like your antibiotics, your antifungals, your antivirals. Analgesics are your pain meds, prescription, non-prescription, opioid, non-opioid. We had to learn about cardiovascular agents. So, you know, what types of drugs do patients take when they have high blood pressure, when they have congestive heart failure, when they have things like angina, when they have like a arrhythmia problem where their heart doesn't beat in a normal fashion. Different things like that. And a big, huge thing was the antihypertensives, and there's so many different types. So we had to really focus on those because those are so commonly seen. And clinically speaking, if I have a patient in my chair with tons of blood pressure medications, I'm not going to have them jump out of the chair as soon as I sit them up, because a common side effect of high blood pressure medications is called orthostatic hypotension, meaning that if I sit my patient up too fast, they get up, they could pass out and have a sudden drop in blood pressure. So I let them sit in the chair for at least 5 minutes, then they can rise out of the chair and comfortably leave without having a drastic drop in blood pressure. Endocrine agents, woohoo, that's like stuff that diabetics take, and not only diabetes, but people with thyroid problems, people with adrenal gland problems, you know, related to the adrenaline versus, you know, non-adrenaline, Addison's disease versus Cushing disease. So once we got past the adrenal diseases and thyroid diseases, it was pretty much like diabetes stuff. So it was kind of like, So I got to learn a lot more about what type 2 diabetics take, and then obviously type 1 diabetics, and how we, what we really got to watch for with those different things. Biggest thing for diabetics is, you know, low blood sugar. So it's best to have a diabetic do a morning appointment just so that, you know, they're going to eat and most likely take their meds. I've dealt with a lot of, and I'll talk about this in my clinic level 3, I've seen several diabetic patients of both types already, so it's kind of cool to like get to experience that. Then we had to talk about anti-anxiety meds, anti-seizure meds. We had to talk about anti-cancer drugs, so that was a kind of a little preview into my cancer portfolio. And then we talked about like respiratory drugs, you know, people that take things for asthma or COPD, chronic bronchitis. And then the very last thing we talked about is people who take like herbal products and herbal supplements, and then like GI products like for like your digestive system. and then my review guide. Then we had to write a paper on a patient that we saw in clinic that took a specific medication and write about it, and I wrote all about hydrochlorothiazide, HGTZ, which is a diuretic antihypertensive medication, so that's used to reduce blood pressure. So I had a patient that took that. I actually, like I said, I have a lot of patients that take high blood pressure meds. It's very common. I see that on their medical histories. A lot of anti-anxiety meds I see a lot of. And on occasion I'll get things for like congestive heart failure or preventative things. Seen a lot of people on Synthroid, which is what you use for a hypothyroidism, so that's pretty common to see as well. So you really need to learn all these different drugs and like understand what their implications are to your dental treatment. I'm using student RDH to study for my boards, but we got this ahead of time before we even like signed up for it, and this is just a top 150 drugs and dental implications that I really need to know, not only for my boards exam but for clinical application, because I'm commonly going to see patients with things like amoxicillin, like that's an antibiotic we would use maybe for dental treatment, or they might be on for an infection. Things like warfarin are an anticoagulant drug. A lot of people who need those anticoagulant drugs are going to be on warfarin. We need to know what they do, what's the dental implication. Maybe it's extra bleeding, maybe it's dry mouth, maybe they have delayed wound healing. So you really got to look at the patient's whole story, because sometimes what's causing their oral health problem is the medication they're on. Sometimes no matter what you do, people that are on like calcium channel blockers, for example, can have an overgrowth of their gum tissue, and it can get really puffy, really red, and really inflamed. Not necessarily their fault, but it's important that they come in more regularly for cleanings, because those puffy, red, inflamed gums are so much harder to clean around. So we don't want all that plaque and tartar to sit on them for very long and agitate those gums. So there's a lot of things you can see that happen in the mouth. For insulin, as far as I'm concerned, there's really not any implications for taking injectable insulins. Your biggest worry for me is, if you had me as a patient, would be, is my blood sugar going to be okay? So watching patients to make sure that they've eaten with their, had a meal with their medication, or when's the last time they ate, what's their last blood sugar, being ready to go with, juice in the event that they would have a low blood sugar. So it's not only understanding like what can happen in the mouth, it's like how to prepare yourself for a medical emergency with a different medication. So, like I said, I've had a lot of patients with slews of medications, and I'm impressed like how like a pharmacist and a doctor know what to prescribe and like what interacts with what, because I love this class and I did really well in it, just because a lot of it's memorization and clinical application after the memorization. But I couldn't imagine knowing all of it and knowing like every single pharmacokinetic or chemical component of like these drugs and like what interacts with what. Like we had to know some of that. Like mainly I have to really know what interacts with like a local anesthetic, because that's probably the most common drug I'm going to dispense to a patient if need be, is to administer local anesthetic. So I really need to understand some of that kind of stuff, but I don't need to understand like every single interaction that maybe a doctor would see. We have to have a very general basis of these different things, but kudos to any pharmacist or doctor or biologist, chemist out there that has to understand this stuff, because it's a lot. And it was a lot just to understand the basic stuff for what a dental hygienist needs to know, for the pharmacology for a dental hygienist. So I gave you a lot of credit. And like I said, I loved this class, and I think it's so applicable and so real life. And if you're not like super into memorizing different things, it's probably not going to be a class that's really going to be for you. But if you are going to be a dental hygienist, you have to probably take this course at some point. Now, like I said, I don't know what the requirements are for different states or countries, but in the state of Wisconsin at my school, pharmacology is a huge part of our learning. So again, a lot of this was all online or via like online classes where we met like on a WebEx or like a Zoom class, like our form of Zoom, if that makes sense. Because we didn't have anything like in person beyond the clinical part of it. All my lecture stuff for my clinic level or process 3 was all online, and then we did the clinical portion in person. So these are all my lecture classes. I'm going to go ahead and share a little bit about what clinic level 3 was like, and different things like that. And again, I have one more semester, and I hope to be talking a little bit more about my tips for really getting through this program successfully, or a dental hygiene program successfully. Because I'm going to admit to you, it is not a cakewalk. And anything worth doing really isn't a cakewalk. But specifically dental hygiene, I swear, is never going to be a cakewalk. Especially if you have to find your own patients for clinical care. Now, they do help you out in some aspects, and I'll maybe talk a little bit more about that in a future video, but pretty much I want to tell you, like, rely on yourself first to, like, find what you need, because in order for you to move on to each semester, you have to have so many different clinical requirements. And when you go from, at least in my college, from clinic level 2 to clinic level 3, your requirements double because they're expecting you to get more time proficient and really grow your skills as a dental hygienist. And I really like how one of our teachers basically said, your clinic level 2 is literally learning the basics. Clinic level 3 is your growth and finalizing some different things. Your clinic level 4, which I'm already starting to notice, is just really getting your time management down and just, keep building your skills and, seeing that repetition of like what it would feel like in an office. So, let's talk about the big beast called Process 3. Okay, again, binders for everything. I cannot emphasize enough, binders for everything. Again, this is something that normally should have ran clinic-wise for patient treatment, should have only been running 3 days a week, but because of COVID, we did it 4 days a week. So we were in the clinic, at least my A group, or group A, was in the clinic Monday afternoon and Thursday afternoon and Wednesday and Friday morning. If you didn't see one of my videos about my opening about my health and stuff like that, go ahead and watch that. But I will kind of explain to you, you really need to make sure you have somebody in your chair at all times. I had one day that I did not have anybody for a patient treatment day, and they basically, I don't want to say like, I want to make it sound horrible, but it's not ideal when you don't have that patient, because first of all, you're not learning, and then you lose that day for, meeting requirements. Thankfully for me, it really didn't make a huge difference in my schedule because I didn't have any problems since that one thing happened. I had backup plans and stuff like that. Unfortunately, none of my backup patients could come in for me on that day, which it sucked, but it was what it was. But they really emphasized you having that backup plan, because once you start getting into clinic level 3 and 4, your requirements are much more advanced. So, like I said, for this semester, or last semester, in Process 3, we had to, like, basically all our things doubled. So, like, I only finished 7 patients in Process 2. This past semester, I completed 19. So if that lets you know kind of the growth and development that you learn, that's basically what it's like. Easy patients are patients that, you bring in your chair regularly like that, they're going to take you 1 or 2 appointments. In clinic level 2, a patient that was, more of that need would maybe take me 3 or 4. Patients who need more preventative and comprehensive care in clinic level 2 would take you, anywhere from 5 to 8 appointments. And now those patients for me take 3 to 4, sometimes even 2, depending on how things kind of plan out. So, again, you have different requirements on age, level of periodontal disease, certain types of x-rays, to the amount of fluoride treatments you provide, desensitization treatments, how often are you using an ultrasonic. Now, it was a little different for us this semester. I did all my ultrasonic enrichments separately away from real people because we couldn't use them on real people till the very end of the semester. And by the time we came to the end of the semester, any of the patients that really would have qualified to have been able to, I would have been able to use the ultrasonic on, or who could have really benefited from the ultrasonic, I was completed with all those patients. I was basically just filling my schedule, if that makes sense, at the end of my semester. All my requirements were met. I was just literally, like, the last 3 weeks, I was really just scheduling random people in that wanted to come in off the call list, or like personal family and friends that maybe just wanted to, help me out a little bit and come in and get their teeth cleaned by yours truly. So, that's like another check off you have to do. Now that we have our filtration into place, I've already used the ultrasonic on like 3 different people already that I've seen so far in clinic level 4. Things like, like I said, age requirements. So like by age, I mean like so many adults, so many older adults, so many teenagers, so many kids. By x-rays, I mean so many different panorexes, which spin around your head, so many different bite wings, which are very commonly, taken in a dental office for cavities. Those are the 2 pictures on each side. So many full mouth series, which is basically literally taking a picture of every single tooth. I took a lot of x-rays last semester, and it was funny. I was looking at my grade slips beforehand. I obviously can't show you patient's name, but this is our like prescription and grade slip, and then they grade your x-rays based upon what they see. You guys, I took like so many x-rays. And on top of the x-rays and all your requirements for like age, periodontal health, all the different things, you have to do so many different evaluations. So like in order to do these evaluations, you have to be on for certain ones they require very specific patients. So for example, in order for me to do a certain instrument eval, like with a scaler that you would use in the mouth, it had to be like in so deep of a pocket, and it had to be a piece of tartar below the gum line. So you really had to be, picky when you found the patient that qualified. I highly suggest you do your eval and get it done with right away, and that's what I did. So that made the semester a lot easier. We also got to learn how to do SNRP, which is deep cleans, which is scaling and replaning. I absolutely love doing scaling and replaning. These are your patients that have a lot of active periodontal disease and can really benefit from you doing a deep clean. The only really difference between a normal clean and a deep clean is we're really working on the root surfaces a lot more, and we're taking off any dead bacteria and tartar that's sitting right at the base of that root and getting it out of there. And then our goal is to either do maybe either leaving it sit or doing like an arrestin placement, which is an antibiotic in the periodontal pocket, or doing a laser treatment. And our goal is to kind of get that attachment to be a much nicer attachment in the mouth. It'll eliminate redness and erythema, maybe any bleeding that's associated in those deeper pockets, so that the gum tissue has a chance to attach back to that tooth, so that it's easier for them, number one, to keep at home, but number two, that we can slow the progression of periodontal disease. Now, once you have periodontal disease and bone loss, there's no going back. Like, you can't like say, okay, this patient is a perio skill level 2 or 3, and then you heal the sites that have the deeper pockets, but because they still have that bone loss, they're still considered a periodontal patient. Now, does it mean that the periodontal disease is active anymore? Probably not, especially if you really focus on them with home care, and the deep clean worked. And then with these patients, they had to come back like 4 to 6 weeks later, and then after you completed the deep clean, we would do a reevaluation to see kind of how those look. We would take pictures, and you'd get to see like the change in the color of the gums too. Is there any less bleeding? How's the plaque looking on those teeth? Is there any residual tartar or calculus on those teeth? It was, like I said, it was like the coolest thing ever. And I am doing 2 more deep cleans in my clinic level 4, and I'm super excited to do them. I have both of those patients that need those deep cleans, which is awesome. And they're very excited to have them done. The beauty of process 3 was really seeing a huge variety of different patients. Not saying I didn't see a variety in process 2, because I certainly saw a variety. But you really get a variety because you're just going to be seeing a lot more patients. So you get the opportunity to experience everybody, of array of different levels of like what's going on with their gums, to their periodontal health, to, the level of buildup in their mouth, to their age, to what x-rays are they going to need. Things like that. We also got to do nutrition counseling and tobacco cessation with a patient. The nutrition counseling was done here at home with a patient at home, but then now this semester I have to do it with a patient in the chair, which is fine. The reason why they didn't make us do it chairside last semester was to save time. They just made us do the tobacco one. So like you have to have a patient who smokes that would be willing or not willing, or would be willing to quit, and then you kind of have to talk about the effects of oral health and tobacco use, right? So it was really like giving those patients those comprehensive services and those types of educational resources that they would need. Nutrition counseling is more like, okay, analyzing a patient's diet, for example, and then looking and seeing, okay, is their diet putting them at an increased risk of having cavities? Is their diet putting them at an increased risk of different things that can happen in their mouth, like a dry mouth, or mainly it's for cavity prevention, because if people are eating a lot of super sugary, sweet, acidic things, and they're doing it on a regular basis, they would benefit from nutrition counseling, because you can really say, okay, the foods you're eating, and when you're eating them, make a huge impact as to why maybe, cavities can happen in the future, and maybe explain to them how that process of cavities work. So again, you're seeing all these different connections from all these different classes I've taken previously, and you're implementing it. We had to do x-ray interpretations, which like you take an x-ray on a certain patient, a certain type of x-ray, and then you have to identify anatomics on that patient. and identify any abnormalities. Does that patient got an abscess on the tooth? Does that patient maybe have some abnormal looking root pathology? And again, you're applying what you're learning to what you see in clinic. Have I seen like pathologies, like, I don't want to say major pathologies, but I've definitely seen patients with abscesses and lots of areas of decay that should be looked at. And I'm sure a lot of my classmates can say the same, that they've had a lot of people in their chair that have needed some restorative or more preventative dental care. So it's really taking like what you're learning and applying to what you see in clinic, and really interacting, again, learning how to grow your skills and interact with the dentists, and then of course your hygiene instructors as well. It's really, really cool that we get every single day we're in clinic, except Thursdays we have a community dentist that's on site, but he's not in our actual clinic, but he's just on site. But like our Monday clinics, Wednesday clinic, Friday clinic, and then Monday, Wednesdays for us now that I'm in my clinic level 4, we have dentists that volunteer and come in on our clinic time. In order for us to do cleanings in the state of Wisconsin, you have to have a dentist present in the building. So what's cool is we do our cancer screenings with our dentists. We do our restorative check with our dentists, so that you go through tooth by tooth, and then you check out like oral cancer. You do the screening, and then you reiterate to the dentist what you found, and then they grade you on that. So it's a really cool experience to interact with, you know, different dentists, and like kind of how, as a hygienist, that I would interact with the dentist. That's something we did in process too, but it's like really cool, like to see the growth and to see the speed that you get and the fast you get at, you know, understanding different things and going through the whole entire assessment of each patient. So yeah, that was like process 3. It was interesting and a lot. It basically was growth and development, and then like learning how to do the deep cleans and then doing them on people, if that makes sense. And then obviously you keep taking x-rays, you keep seeing patients who are coming in regularly for their cleanings, and you know, all those different things. And I was able to find all my own patients, and I did take, I want to say, we have a call list that you can call patients off of and put them in your schedule to fill your schedule. And I think I scheduled, I want to say 4 or 5 patients throughout the semester that were off the call list just to fill my schedule, that have been seen there previously by other students, and they just want to be continuing to be seen there, you know, for the educational portion of it, or like to help us out. And again, they were all super friendly, and like I said, I had one of them give me a gift card, and I'm like, hi. It was like super sweet that she was so touched that like I cleaned your teeth. She's like, here's something for you. I'm like, oh. Like it wasn't like I wasn't like expecting it, but it was like, oh, that was super sweet. And I've had a lot of people like, you know, personally thank me, you know, for doing services for them and helping them out and stuff. And I've had so many people that have had such a good experience that they're going to come back for me as recalls in my clinic level 4. Now we have to see so many new patients, of course, you know, because again, requirements, right? But you have to see so many recalls. So it's kind of cool that like I have a lot of people that like want to come back. And it was kind of cool because I messaged one patient that I found mutually, and her primary dentist is like way south of here. And I found it kind of funny. I'm like, oh, I accidentally gave you the wrong time that you can return for a cleaning to your primary dentist if you want. I said, and it was like April, blah, blah, blah. I said, I accidentally told you it was February, but it's actually April. And she goes, what did she, I can't remember exactly what she said. She goes, oh, no problem for the mistake, and I'd love to see you again. I ain't going back to my primary dentist until you graduate. I'm like, okay. So obviously, like, this patient wants to come back for a cleaning. I'm like, okay, no problem, you know. And she was super sweet, and I'm like thinking, okay, like I made such an impression on this patient I never met before, and she wants to come back. Like that's like really cool to me that like she wants me to clean her teeth again. Like she had such a good time that she wants me to clean her teeth again. And I feel like that's with like every patient I've seen, like, oh yeah, I'll come back, sure, when can I come in? And it's like scheduling is kind of a mess right now for me. But you get to really build some relationships with people, and you see a lot more people, so that you get to experience a lot more different things that patients are going through. As I said, it was a very challenging semester only because we had to fill 4 days of clinic, and like I said, I only had 1 day. I didn't have anything. And everything else went really smoothly. And like I said, I'm very blessed and lucky that I'm able to find my own patients, to really get the variety I need. And then I just take call as patients for supplemental educational experiences. but you have to rely on for finding patients, and I'll talk about this in the future. Like, your best bet for finding patients is basically through word of mouth. And what do I mean through word of mouth? I mean like people you've seen like in clinic level 2 that you started treating patients and they enjoyed their experience so much, or you made a connection with them. They might say, you know what, I got a friend that would really, benefit from being seen by you, or they don't have a primary dental home. Can they come see you? Absolutely. I would say the vast majority of the people that I bring in don't have a primary dental home, and I'm able to provide a lot of comprehensive and preventative services to patients who need it the most. And it's so rewarding and it's so beneficial to see them happy and wanting to come back. I've had people that haven't been to dentists in years, like years and years and years and years, and had such terrified anxiety of the dentist. They came in and saw me and they're like, I'm coming back. Like, you've given me the motivation to go find a dental home, because I know how important it is now, and I don't know why I had so much fear. You got to really like build that trust with people. And like to say I made an impact on some people's opinions on a dentist is kind of cool. To be honest with you, that they're not freaked to go to a dentist, or they're not as nervous about going for a dental appointment, and they understand the importance of coming in regularly. And it really warms my heart that a lot of the people that have reached out to me that don't have dental insurance, that I'm able to provide them dental care for at least until I'm there, and then hopefully they'll continue to go there, or maybe I can help them find a dental home. And then I've really put a different spin and a different perspective on dental care and how important it is, because it saddens me that not a lot of people can get access to dental care. It saddens me a lot of people don't have dental insurance. A lot of people don't have different things that they need. So that was clinic level 3. It was a lot. And like I said, I hope after I graduate to really delve into like how exactly I ended up finding a lot of my patients, because I used a variety of different things, but like I found personally for me, for the 3 semesters that I've been going through dental hygiene school and having to find and recruit your own patients, is really just word of mouth. Yes, you can use Facebook and like share posts and whatever, like social media, but I personally find it's word of mouth. It's like people saying, oh, I had such a good experience, and like that's how one of my mom's coworkers came in and saw me, and it was a really great experience. Different things like that. And somebody, again, locally, a friend of mine found another friend that hadn't had dental care in years and wanted to be seen, and was interested. So you got to make sure you find the people that are like interested and like willing to come in, and that really want the help and stuff like that. And I've been very, very, very blessed and lucky to have very reliable people, and people that are so understanding that it's a learning environment and that it usually takes multiple appointments to complete their cleaning, because it's not necessarily me, it's the checks that I have to go through. Every stage I go through, assessment phase, cancer screening, and the very final check at the end, like that has to all be checked by a hygienist or a dentist. Because they want, obviously I'm a student and I'm not licensed yet, they have to make sure everything was documented correctly and done properly. So like when I clean a patient's teeth, like I'll clean their teeth, an instructor will come in and check and make sure there's nothing there, and if there is something there, they explain it to you and they show it to you, and then they'll expect you to sit down and take it off in front of them, and then they'll recheck, and if it's gone, you're great. So it's like that kind of thing. So like you have to have everything checked out and finalized out, if that makes sense. Like, I do a gum tissue assessment on a patient, that gets checked. I do my tartar assessment on a patient, that gets checked. I do a care plan for my patient, that gets checked. I do my cleaning for my patient, that gets checked. So that's why it takes oftentimes a lot of appointments. Now, and I'm not saying it's like they have to come back 58,000 different times, but on average it's at least 2, if not 3 for most patients to come back. And again, it would depend on what they have, it would depend on like the comprehensive services they need. If they need like a deep clean, that takes a little bit more time. If they need things like desensitization, or they need the use of the ultrasonic with hand scaling, then again, that's going to take more time. If they might benefit from a comprehensive service like like tobacco cessation or like nutrition counseling, that's going to take more time. But like I said, I've really had like 0 problems finding what like, not, I don't want to say finding, but like getting all the educational experiences I'm required to have to be a hygienist. And then that's the hardest thing about the whole program, is like You don't know what's going on in a patient's mouth until you get them in your chair. And some people you'll be like, wow, you know, they could really benefit from a lot, and other people come in and it's like, cool, you know, you can, you know, you get another skill builder or something on them, or you know, seeing differently what's going on in different people's mouths. And it's like the variety is key to really getting through dental hygiene school, just a variety of different people. And again, like, the best thing, like I said, that you can do for finding these types of people is just word of mouth. And like, I actually, this semester, I was working on securing 2 children, particularly that needed x-rays. That's kind of like a thing for us to graduate. Like, we have to have kids that need x-rays. So, I made a very specific post, or I don't remember that I asked people. I don't remember exactly how I did it, but then I was able to find somebody very locally that's in need. So it's kind of cool, like, and then it's cool is like, she knows me. Whether she realized it or not, she knew me. And she was like, oh my God, I know exactly who you are. So it's kind of cool to like make that connection. And like, once people like figure out if they know you or know that you're somebody's relation, like, they're more willing to help, if that makes sense. And like, they understand that, like, yes, in order for you to be licensed, you have to learn. You have to get the skills on real people. And I've never had a patient yet tell me, you suck. I mean, I've had a lot of people go, this is like the most comfortable cleaning I've been to. This is the most thorough cleaning I've been to, and I really enjoy it. Yes, I have to come multiple times, but I'm really learning a lot from you, or, you know, I'm really getting the benefits of like what I wouldn't get in a 1-hour cleaning at an office. So there's perks, and then there's obviously the downfall of having to come multiple times, but there's a lot of perks with, you know, patients coming in to our clinic and getting care by us as students. It's very thorough, because if you think about it, I'm doing all my assessment stuff, and then it's getting double checked by somebody else, and different things like that. So that's kind of the scoop on how clinic goes, and that was clinic level 3. And I kind of wanted to talk a little bit about something that maybe some of you maybe know about, but maybe don't. Talk a little bit about something really awesome that happened from clinic level 2, and I will kind of explain that right now before I end this video, so that you kind of get an idea of what was going on. Like, I finished my clinic level 2 stuff in the summer. Now, your clinical grade weighs the most on your overall grade for your clinic level. So, like, what you're doing hands-on, right? So in the summer, we finished up our clinic level 2 stuff because of COVID, when we should have been done in like, May? So we finished our stuff up in July, and at the end of August, our grades were posted, and I ended up getting, I was 0.15% away from an A grade in clinic level 2. Now, an A in my program, you have to be at a 93 or higher. We're on a 7-point grading scale, which makes it pretty tough, because in clinic level 1 and 3, I, again, was like 1% away from having an A. But nothing could be changed from those grades, because everything was done accurately, which is fine. Like, I don't think an employer is going to care if I have a, as I was saying, an employer really isn't going to care if I have a B or an A in a class, right? Like, if I'm competent to do dental hygiene, I can make it through every single semester. In order for us to get through our program, though, you got to have a C or higher. They don't want you at an F, right? I mean, you'd have to repeat your clinical course. But our clinical stuff is graded on a website called Tal Eval. And you do get points for completing patients who are have more tartar in their teeth, or patients who have higher levels of periodontal disease, meaning that their periodontal disease is more severe. So like perio level 4 is like the patient who has the most severe periodontal disease, versus 0 is like 0 or healthy. And then for our tartar classifications, patients who are calculus class 4 are your most involved tartar patients, and then 0 is like no tartar. 1 and 2 are your simple lights, 3 is moderate, 4 is considered heavy. So you get points for completing those different types of patients. And, you know, me and my clinic level 2 coordinator were looking through, and like, she's like, you're so close to an A. I'm like, I know. I said, and we couldn't find anything. So I'm like, fine, I'll just settle with the B. And it was kind of like devastating, because I was like literally 0.1% away. So I was like, I'm like, okay, you know, it's fine. Like I said, an employer isn't really going to care of B or an A. Come October, so almost like 3/4 of the way through clinic level 3, I was going to see my mom again, and she gave me permission to talk about this. And I wanted to see what my mother's levels were at last time, what her tartar level was and what her perio level was. And I was going through my client care list. We have a client care report of like the patient's name, their age, perio, tartar, and when they were last seen. So I was like planning to see her as a recall patient again. So I was looking through maybe 3 days before I was supposed to see her. And I'm looking through and I'm like, oh my gosh, they never put points in for my mother's perio skill level. Because my mother's a smoker, and the level of bone that is missing around some of her teeth, she is in the highest perio skill level. When you're in clinic level 2 and you're dealing with some higher perio skill level patients with, more active periodontal disease, you get quite a few points. It's not like 50,000 points, but you get a good amount of points in your tally val. The points that you get counteract any errors that you might make. So the more advanced patients or more involved patients that you work with, the better off you are as far as building your skills and having them to kind of bounce back your errors, because they understand that okay, you're going to take more time with this patient, so we're going to give you a little bit of a reward for completing this patient. So anytime you'd final out a quadrant in a patient, you would get the points. Now if you finaled out 2 quadrants or 2 areas of their mouth in one appointment, you get just that set amount. So on a Calc 3 patient, if you finaled out 2 quadrants in one appointment, you would get just the points or whatever. I saw my mom over the course of 3 appointments, but 2 of those appointments I was spent cleaning in her mouth. I got points for the first appointment that I started cleaning her mouth, but not the last appointment. And I found another patient who I saw, again, perio skill level, I'm not going to say the name, but her perio skill level was moderate, which was a 3. And I never got points on the very second appointment that I saw her and cleaned her teeth as well. It was actually a coworker of my mother's. Did not get the, she was a more involved patient due to smoking and a couple other factors. I never got those points. So I quickly emailed my clinic coordinator, who obviously is now working with first-year students. I'm like, by the way, I found a couple mistakes. I said, I know I was inches away, or millimeters away from an A, and I said, I think, adding these points is going to make the difference. It was kind of a long process because she had to go through every report, every clinical note, all my patient treatment care plans, all the clinical records that we had to leave, and then she also had to go through every other student's clinical care reports, because obviously in order to make it fair, to make sure nobody else missed out on any points, that she did that, and that was fine. I got a communicated with her maybe towards the end of my clinic level 3, in mid-November, and I got an A. My grade got changed to an A from a B. So what this is saying is A versus B is not going to determine okay, is an employer going to not hire me because I didn't get an A in clinic level 2? No, what I'm saying is if you earned something, fight for it. And if you see something that is discrepancy, fight for it. And to think if I would have let that go, I would still have a B in my class. Not saying, like I said, the B is not going to be a huge factor, because a B is still a great grade. But to me, if I'm that close to being that next level, why wouldn't you try to fight for it, especially if it's something to the bare minimum that literally pushed me at 93%. It pushed my grade from a 92.35 to a 93, which is an A. That was the difference between a high B, a very, very high B, to a very low A, but an A. So I got my grade changed after a little bit of looking at through some different things, and I made sure, now I'm making sure I did that in clinic level 3 and clinic level 4. I'm checking my clinical grade every day and making sure I'm getting the appropriate points or documentation noted for anything, because why wouldn't you, right? It's your grade, and if they're making errors that's something you need to bring up. And not getting those points in that electronic grading system was the fault of an instructor and not mine. And obviously it's still my responsibility to look at it, but I learned my lesson to definitely look at it through it, because obviously 3 months down the road she had to dig up through all these different records to get the grade change. And like I said, I'm grateful she did it. She could have just said, no, we're not going to bother to do it, but she did. And she was able to check through every other student's record. I don't know if it resulted in any other student that may have been borderline A to get their grade bumped. I have no idea. I didn't hear anything from anybody. But I'm thankful I spoke up, because then again, if any other students, there was any discrepancy with any other of my classmates' clinical work, that they maybe could have gotten their grade changed. So it's always good to look at that kind of stuff and look into that stuff. So I got my grade changed, and it was kind of cool. So like I said, I don't really at this point, like, because the 2 B's I've received have been very high B's. You look at the percentage of like the courses I've taken, the lowest percent I've ever scored in a class is a 91.8. So you're talking like a 92%, and that's the very top line in my program for a B. And I can give myself a pat on the back. I've got 2 B's the entire classes I've taken for my program, including general education courses. 2 B's. So far. 2 B's. That's crazy, like, how much effort and hard work I'm putting into this program and all these classes. And I'm taking my time to study and really look at clinical skills. I'm looking at my lecture skills. I'm looking at everything to, put forth my best effort. So I was super grateful that grade got changed. Again, not because I'm saying that, a B to an employer is going to be any worse, but if that grade is your grade and you were darn certain you earned a different grade, look at it. I mean, it doesn't hurt to look into that stuff, and that's what I'm here to tell you. Like, and I've had nothing but pleasant experiences with interacting with that kind of stuff at my college. Our instructors are very good about looking at that kind of stuff, and they're very understanding. I don't know about other colleges and other programs. I don't really know. And I don't even know if grading scales are different per college. I would assume so. Maybe some colleges are on an 8-point grading scale. If that was the case, I'd have A's in every single class. But no. That doesn't really matter to me. And it's actually a better grading scale than my high school was. My high school was a 5-point grading scale. So in order for you to get an A, you got to get a 95 to 100 to get an A. Of course, they have like the things like A, A minus, B plus, B minus, B, C plus, C, C minus, D plus, D, D minus, F. They have like all the pluses and minuses in between. In college, it's either here, it's A, B, C, F, I think. I'm gonna double check in my syllabus here, but I'm pretty sure it's A, B, C, F. Never mind, there is a D. So yeah, a 7-point grading scale. So to get an A, you have to have a 93% to 100%. B is 85 to 92%. C is 84 to 78 to 84%. So like in my program, you get lower than a 78% in a class, you're done. It's that simple. You're done. They want they want you to have A, B's, and C's. Obviously, you don't want D's or F's. A D would be 70 to 77%, and anything less than a 69% is an F. But there's no pluses, minuses, and stuff like that. It's either A, B, C, D, or F. It's that simple. And I highly recommend that, like, the acceleration of a program like dental hygiene, that you really, like, look at to, like, can you keep up, and can you keep up with, like, coursework and stuff like that. And my biggest advice is if you don't have to work, don't work. Some of my classmates do work, and they do fine, but, like, personally for me, I'm thankful I don't have to work. I'm very thankful that I'm very blessed, and I'll talk about this in future videos, that I have had enough scholarships earned from high school for working my hiney off in high school, getting good grades, and participating in different things to have scholarships on my shoulders to pay for my college tuition. I will tell you, I'm debt-free. I don't have any college debt, you guys. And not a lot of people know about it because I don't really talk about it. And like I said, scholarships are not only just based on grades, they're based on merit. So they really want to look at you as a well-rounded person. And I've been blessed in this program. I've applied for a couple of different other scholarships, and I've been blessed to receive a couple. Not only based on just on good grades, they look at merit and character. They look at a dedication to a program like this. They look at different things like that. So that is why a program like this is so hard to get into, and it's so competitive. But yeah, so I got my grade changed, and I'm proud of not only do I have to be proud of myself, I have to be proud of all my other classmates, because this is a lot of stuff that we all have to do together. And we're a team. So, like, we try to help each other out. If somebody has, extra of this type of, like, age requirement, that we share with somebody who maybe doesn't, and then they trade, not saying you want to trade patients, but if you can kindly ask a patient You know, you are an age requirement that maybe my friend, you know, needs to graduate. Would you be willing to be seen by them? And oftentimes a patient will say yes, because they understand. They understand you have to have X, Y, and Z to graduate, right? Because the state of Wisconsin says I have to be in so many kids, so many adult mouths, so many in this, take so many this x-ray. You get the picture. Like, I have to do so much of this in order to literally be licensed as a hygienist, because they want everybody coming out of the school with the same skill level. Not saying that one, you know, classification of one patient that I see is going to be any easier than the same classification of another patient, because every patient's mouth is different. But they can give you basic standard guidelines saying, okay, if you worked in so many adult mouths, you worked in so many perio level this mouth, tartar level this mouth. You know, if that makes sense. Like, so anyways, that's all I have to say for dental hygiene school. It's been a roller coaster, and we are 4 or 5 weeks into our clinic level 4 and a couple other classes. So continue to wish me and my classmates good luck. We are like 3 months away from graduating. And for me personally, I'm sitting in very, very, very good shape as far as what I need to graduate, as far as like my last semester of like requirements or like clinic level things or like clinical things that I have to be doing with different things, that makes sense, like x-rays and X, Y, and Z, like age requirements. Like, I'm sitting very, very good right now. So continue to have good vibes for me, good vibes for my classmates, and like I said, we're a team. We help each other. We lean on each other. We study with each other. We got a great group of 17 wonderful gals that we're all going to make fantastic hygienists, because we're resilient and we're good people. We made it through COVID. Like, to be doing this stuff in the midst of a pandemic, high risk, mind you, getting stuff stuck up in your face with PPE and N95s, like, to be making it and going through it is challenging, and we as a class are super tough and strong. Like, to be honest with you, like, if you graduated from any like college or like especially any hands-on program in 2020 or 2021, hats off to you, because it is not easy. You're lacking in some of that wonderful social experience that you don't get to get with COVID. They often, like, on my campus, is pretty much shut down other than for clinicals. So like, if I'm in dental hygiene, I'm only on campus for clinicals still. Everything else is online. If I have a lecture course, it's online. Any lab component is in person, but any lecture course is online. So to see my college pretty much empty and dead, it saddens me. You can't see the hustle and bustle, and like, it gets me teary-eyed and it gets me sad. Like, to have to wear a mask on campus 24/7, to wear a mask anywhere. Like, there's so much that was stripped away from COVID, but I'm still getting my education, and it's such an amazing opportunity and blessing that I get to experience this in my schooling. And it's also going to prepare me well for the work world, that if I can handle COVID-19, I can handle anything, right? If I can handle dental hygiene school, I can handle anything. By the grace of God, I've gotten through it day by day. And there are some days that you'll have days in clinic where you're going to feel like you're rocking, and other days you feel like you're going to suck. And it's not because you suck, it's because you're getting a really good learning experience on maybe a particular type of x-ray or patient. Every mouth is different, and that's such a beauty of dental hygiene. Like, I've seen so many different things. It's so cool to like look in somebody's mouth and be like, ooh, you've got this going on. Like, I've never seen this before. Like last semester, I found one patient the entire time, he's tongue-tied, and he can't take his tongue and lift it to the roof of his mouth, and I thought it was the coolest thing ever. I'm like, oh my gosh, you're tongue-tied. And it sounds like silly to me, but like, for me, when you see that, you learn about it in a class, and then you get to apply it, it's like even cooler, right? My grandma has geographic tongue, and I'll show you a picture what geographic tongue looks like here. But it's cool, like, every time I see my grandma, I get to see geographic tongue, so it's like, stuff like that. But anyways, I'll end this video here, because this video is probably like an hour and a half long, but I hope you enjoyed it. This was semester 3 dental hygiene school. My room looks like dental hygiene school threw up in it, and it looks like that every single day. I'm currently working on a poster for process level 4. I am currently doing laundry. I am currently trying to find something to eat. So my life is a total, like, literal mess, and I would show you my room right now, but it's absolutely embarrassing. So anyways, I'm going to end this video here. If you enjoyed this very long video, give it a big thumbs up. Feel free to hit that subscribe button. I post as often as I can about diabetes, plus more about my life. If you have any questions regarding diabetes, or you want to know more about hygiene school, please let me know. Again, I'm going to be making more videos regarding boards, how I'm studying for boards, both written and clinical boards, how I am planning on where I'm maybe planning on working after I graduate. And again, I'm going to talk about my last semester when it's done. And I'm going to talk more about like tips and tricks for getting through this program, because again, I'm still in the program because I'm in my last semester and I'm still learning some things as far as like how to be successful, like some other things. You learn and grow each semester, right? So I kind of want to complete the program before I can like tell you, hey, definitively what worked for me and what didn't work for me. I will tell you this much, what didn't work for me last semester, a lack of sleep and a faulty insulin pump. But that's something that I was able to kind of figure out, and now I'm getting myself on a sleep schedule. Like, sleep's so important in dental hygiene school, but there are some days you're going to feel like you can't sleep, like you're going to stay up 24/7. But anyways, until next time for another video, take care, God bless, be kind, spread positivity, and be thankful, and I love you all from the bottom of my heart. Thank you for watching, and I will see you next time. Bye.